fellowship-trained prostate cancer and urological cancer specialist, and also fellowship-trained robotic surgeon. What that means is that I spent 9 years at various universities learning to be a subspecialist for treating urologic cancer with robotic technique. And that's what I've been doing since I have been in private practice for the last 5 years. So what I'm talking about today is what I've been living, breathing, and doing every day of the week. So prostate cancer screening is sometimes referred to as prevention or prophylaxis. That's actually not true. Okay, any kind of cancer screening, whether it's a mammogram or a colonoscopy or prostate cancer screening, is to detect cancer early. And the idea there is you detect it early so you have a better chance of curing it so that it doesn't cause significant problems or even death. What I'm going to try to do today is kind of demystify prostate cancer, demystify prostate cancer screening, and just try to explain what it's all about. Prostate screening is currently recommended to start at age 40. It's screening that's done once a year. It consists of a digital rectal exam and a PSA blood test. PSA is prostate-specific antigen, so it's a simple blood test. It's only been around for about 20 years. We've only really understood what it means for about 10 years. It has, however, not replaced the digital rectal exam. So going to a health fair and getting just a PSA is not as good as getting a PSA and also having your prostate examined. What's the benefit of prostate cancer screening? Well, if you undergo prostate cancer screening, you're less likely to die of prostate cancer. There's been 4 studies. One is Olmsted County. That's the area around the Mayo Clinic in Rochester. In Tyrol, which is a province of Austria. And there's the PLCO and the ERSPC trial, which are North American and European trials, respectively, that look at this throughout the continent of Europe and throughout the continent of North America. Overall, what these studies all show is that by screening for prostate cancer, you decrease the number of prostate cancer deaths if, as a result of finding prostate cancer, the patient is offered the appropriate treatment options. If you just screen for prostate cancer, but then don't do anything about it, you don't have the same benefit. So what's important? How do you make the individual decision? Well, the first thing is, it's the most important time to screen for prostate cancer is relatively early. You start at age 40 and you're consistent and get 1 test every year. Try to get it about a year apart every time. It doesn't have to be the exact week or the exact month, but just about once a year. Because we know now, when I said earlier the test has been around for 20 years, but only for 10 years have we really known what it meant. How high your PSA is, you know, there's that magic value of 2.5 or 4 that, you know, the lab report says should be less than, and it's going to have an H for high and for out of range if it's more than that. What your absolute PSA level is actually means less than what your PSA does from year to year to year to year. So if you have a PSA that's 4.5 and you have a biopsy and there's no cancer, and the PSA stays 4.5 for the next 30 years, you're in really, really good shape. If your PSA is less than 1, and it's less than 1 for 2 or 3 or 4 or 5 years, and then all of a sudden it goes up to 1.5, and then to 2, and then 2.5, and then 3, that's dangerous. So something that just kind of coasts along is fine. If something is sort of rising quickly, that's where there's a problem. So even if the level that we get worried about is 2.5 or 4, if you have a PSA of 0.5 for 5 years, and then it jumps to 1.2 and then it jumps to 1.8, you're going to get a biopsy before you get that threshold, and you're more likely to have a problem than somebody who's stayed stable at a higher level. So starting early and being consistent and having sort of a long history that your doctor can look back at, 5 or 10 or 20 years, that's the best, that's the safest way to do a biopsy when necessary and to avoid a biopsy when not necessary. When it comes to deciding when are we done with prostate cancer screening, when can we just stop worrying about this? Well, that's about when the life expectancy is less than 10 years. And so I have to say that men in Dayton appear to be very responsible with their health, and I'm glad to see you all here.